after 24 weeks. Remember, you have international standards and Kenyan standard, or national standards. So that's a loss of pregnancy. So Emma was telling us that this mother, and that is the main confusion. That's the boundary of confusion here, because the lady is now gravid at that time, right? So meaning at para one, which we assume she had twin pregnancy, yeah. So let us assume she had, and then now twins, and for the twins, that's just one parity. That's para one. Let us not confuse by saying para two. Hata akizaa watatu ama wanne, that is para one. Let us draw that line. Hata akipata watoto 10 mara moja at one pregnancy, hiyo ni para one. Now, at second pregnancy, we assume the lady has had miscarriage, which is the loss of pregnancy now. And so now, because she's she's pregnant at that time, I think Emma is so correct. She's now pregnant at that time. That makes us to be para one at twin pregnancy, and twin gestation at a viable babies now, plus one at a lost pregnancy, which makes G3 at that time. Are we together? Then let us come back to our normal pregnancy now without twin. Let us assume that lady had maybe first pregnancy, the baby is viable. Then the second pregnancy, sitakuwa sa para 2. Itakuwa para 2 plus 0 G3 now. Kama ni pregnancy loss, maybe maybe at the now after that time, now you can call it maybe para 2 plus 1 now G4 ukumbele sasa. Thank you so much. Thank you so much. Back to moderator of the day, Dr. Stan. And thank you so much, Emma, for bringing us the aspect of twin, because that is the main point of confusion, twins.
Okay, thanks so much, Mofin. I think it's well understood now. Manu, the likes of Akina Manu, is it now understood? Or we also had Dragoners. They tend to bring a number of tests on this topic. So you need to understand that whether it is parity or gravidity, it is counted whether it is more than 2 fetus, perhaps twin pregnancy, triplets or quadruplets, all of them, in all cases, it's counted as one parity, or one always tells you that that is a miscarriage that did not reach to viability. So whether it is a miscarriage or it is an abortion, that shows 20 weeks. It is 20 weeks. The reason being, in other cases, for example, in abroad nations, they can survive with good environment. Miscarriage happens spontaneously, but abortion usually has a cause. It is induced alternatively. So can we now sit with our paper? Can we now sit here? I'm saying jicho la tatu ndiye ameingia. Hi William. Yes. Yes, Manus, your hand is up. Let me give you 30 seconds.
Yeah.
And then you say something.
I thought kuuliza swali tu sijaelewa vizuri. I don't have an answer, but kulingana na hiyo explain plus 1. Hiyo fetus haikuwa viable. So why do we say plus 1? Because tumesema parity ni ile iko viable, right? So I'm still a bit confused. Just please pardon with me. See, I'm still plus 1 at the end.
Manu, the second digit after the plus sign usually indicates a miscarriage or an abortion. Okay, let's take, for example, Manu, for this case. If this person gave birth to successful and this mother is having one living child, how are you going to write this? Let's just take this example. A mother is coming, and a mother who is having one living child and on her second pregnancy. What is the parity going to be? It's going to be para 1 plus 0. Para 1 plus 0. So 0 indicates that these are pregnant, but it's not reached, it's not delivered. But if we have another digit, it indicates that that was a pregnancy. It was delivered, but it had not reached viability. So the plus sign, the digit after the plus sign always indicates that that is an abortion or a pregnancy that did not reach viability. So I hope we're together now, okay? Can we now see? All right, so you can also help Bihamsa shared something. You can also look onto that. Yeah. We practice those questions most of the time because actually it's just testing on the same thing, but now different scenarios. So allow me to start now. Allow me to, it's okay, Manu. I think a number of people did not yet got it clearly. So let's get number 22. So Biggie, are you having some issue? I think Kathy has summarized everything. Viability, which parity usually indicates viability, and gravidity always points towards, always tells us the number of pregnancies, whether it is viable or non-viable. But viability is usually indicated by parity. So let me start with question 922. Nivile, I was not in the morning session, so I don't know where you were. Question 22, Hame has directed me to get through 22. So question 22 is saying the underlying premise
hello,
of
Stan.
the... Okay.
Okay, excuse me.
Yes, Nanok.
Yeah, in the morning, we overlooked on the paper to be discussed. So after that, we realized it was supposed to be paper 2, KRCHN. Sorry for that. I have already shared it there. I have already shared. It is here. I have already shared it. Yoi. Hello, am I audible? Okay, sawa. Watu wanasema tuanzie hiyo ingine. Okay, sawa, no problem. So Stan, it's your chance, eh? And
Okay, but let's start with this pending question and then we start a new paper. Yeah. So I think it was this one that Hame has shared. Thank you, Hame. The question is saying the underlying premise of the PRECEDE-PROCEED model is that health education is dependent on voluntary cooperation and participation of the client. B, identifying the predisposing factors is more important than reinforcing and enabling constructs. C, the people are presumed to be lacking in knowledge concerning the health problem being addressed. Choice D, the plan of the health education program should start by asking how the problem should be solved before dealing with why the problem exists. The underlying premise of PRECEDE-PROCEED model is that. So what was your answer? This is one of the evaluation models, especially in epidemiology for public health states. PRECEDE-PROCEED. And actually, this is just a mnemonic that represents a number of things, a number of aspects. And this model is usually employed in the set of assessment and also in the evaluative stage. So PRECEDE mostly applies at the assessment stage, gathering data, while the PROCEED majorly employed on the evaluative phase. You remember during evaluation, that's when you say that we judge. Yeah, so I'm seeing number 22 people are going with choice B. You also have A, you also have D, and you also have choice A. So Hame, you had shared something, an evidence on the same. You can just refer down there, we get through it. So I'm seeing it. It said the purpose of the model, the PRECEDE. This is a framework for the process of systemic development and evaluation of health education programs. An underlying premise of this model is that health education is dependent on voluntary cooperation and participation of the client in a process which allows personal determination of behavioral practices, and that the degree of change in knowledge and health practice, this model, appropriate health education is considered in a target population. So health education is the underlying premise, yeah, from that evidence. And we can see how this model can be used in the social diagnosis, epidemiological diagnosis, and also in behavioral and environmental diagnosis, as well as educational and organizational diagnosis. So it's a kind of an assessment and evaluative model. So from that evidence, it's supporting which choice? From the evidence, it's going to support which choice? So that's why we had allocated. So Hame, you are the one who allocated. So your evidence is supporting which choice? And then we'll be able to sit with that. We sit with A, right? That health education is dependent on voluntary cooperation and participation of the clients. Okay. And all of them have education, by the way. So I hope now we can sit with this. So PRECEDE-PROCEED, actually they are correlated in that one cannot happen without the other. One cannot happen without the other. So Kathy, I think that is also in this context. And education is in both words, in both PRECEDE and PROCEED. Actually, in full, zinaitwaje? What is PRECEDE in full? Is it predisposing? Then the next one is reinforcing. Then the E is it environmental or education? These words usually represent certain aspects. So let's sit with A to look the next question. Let me have the new paper. So someone can share, can open that document that I've shared, and one of you can screenshot. You can screenshot what precede and proceed model stand for. Okay, let's begin with question 32. Okay, so let's begin with question 32. I hope now we're together. So question 32 is going to read, population-focused nursing practices requires which of the following processes? Community organizing, nursing process, community diagnosis, epidemiological process, population-focused nursing process. So Manu is going with choice C, Brigitte, Sino, Saidin also going with C, Hamei as well, but Mr. Sifuna and also Symphony is going with C. I'm seeing everyone is going with choice C. We don't have any contradicting opinion. So thank you so much, G. I think G has screenshotted what I wanted to say. Kati, what I wanted to emphasize, you can see in all, even in both of them, both precede and proceed, we have an aspect of education. We have an aspect of education in it. You can see plan for policy, regulational organization, construct educational environment and development. We can see education is in both words. So I think it's also supporting the essence that is the underlying premise in the PRECEDE-PROCEED model. So we're sitting with this choice number 32. Do we have any contradicting opinion in regard to choice C? Can you sit with choice C, community diagnosis? It's population focused. So may you get the next question 33 then. Eh? There are some people having very tough names here. Sijui hata niseme aje. I'll be calling him Uvu. Huyu anakaa King. Okay, so number 33 reads, when the occupational health nurse employs ergonomic principles, she's performing which of her roles? Healthcare provider, health educator, healthcare coordinator, environmental manager. Just going with D, chill D. Water is also going with choice D. And Brigitte D, Klimek D, Sino D, Saidin D, Maggie D. Sifuna D, Kati D, Maya D, Manu is going with A, Uvu D, Lucy D, Emma A. Achukue sulfate. So we have D and Manus going with choice A. So ergonomic principles, that one that entails with the use of body mechanics. In the context of healthcare setting, it entails something that measures to promote appropriate or good posture. Good posture. For example, even with the beds, with the side rails, it entails all that, body mechanics. So in this case, the nurse is employing which context? The nurse is embracing which role? Is it a healthcare provider, health educator, healthcare coordinator, environmental manager? So Sky is asking for some evidence. What are ergonomic principles? What are ergonomic principles? They are majorly to do with Rambo and everything. So I want to ask if someone is having an evidence on the same, you can share with us. But actually, I'm also in support of choice D, environmental manager, looking at the environment of the patient, the one that places him better at assuming the right position. So Katia ametutumia something hapa on working conditions, equipment and materials for safety precautions and possible dangers, cooperating with management in the application, enforcement and training on use of protective measures, giving advice on environmental sanitation and safety education, carrying out nursing administrative duties, which assure the efficient management of the occupational health services, also maintaining symbol records on which to activities. And the nurse assuming the role of the environmental manager, an occupational environment is the combined effects of external conditions and influences which prevail at the place of work and have a bearing on the health of the working population. So it might be in the industry as the worker interacts with different types of agents. To place the right equipment around the patient, the environment needs to be conversant to avoid unsafe injuries to the patient. So the environment should promote the safety of the patient together with the nearby instruments, the nearby equipment that are around the patient. Are they going to promote ergonomical principles? Are they going to promote ergonomic principles? Or is it in support of the role of healthcare provider? So Morphine has also shared something, ergonomics, the science and practice of designing jobs or workplace to match the capabilities and limitations of the human body. So benefits of ergonomics include safer jobs with fewer injuries, increased efficiency and productivity, improved quality and fewer errors, and improved morale. And Katya has also shared something. Ergonomics are also known as human factors engineering, is the scientific study of designing equipment, tools, and work environments that are optimized for human use. So the goal of ergonomics is to ensure that the tools, equipment, and environment that people interact with on a daily basis are safe, efficient, and comfortable, leading to increased productivity, reduced risk of injury, and improved overall well-being. I think that evidence is really convincing. Thank you, Kathy, for that. Let's appreciate Kathy for that wonderful evidence. I think it's very convincing. We settle with this choice, and it's a very yeah. So I think we can have a look at it. It's convincing. Can we sit with choice D? Are we in agreement with choice D? Okay. So let me get the next question. So we thank you, Nanok, also for that input. So let me get question 34. Public health services are given free of charge. Is this statement true or false? The statement is true. It is the responsibility of government to provide health services. The statement is false. People pay indirectly for public health services or force depending on policies of the government concerned. Public health services are given free of charge. Remember this set of questions. Morphine if in the chat. I think you remember these questions. I could remember there's a time the session you mentioned you've just done 3 questions because of the nature of the question. And the trickiness of paper 2 questions. Paper 2 is the easiest paper to have of questions. Let me get now your opinions, your view of things. Why others are going with the likes of Akinawata are going with B sign or B, Bridget to B, and then Momanyi is also going with B. Now here we have A, drafts. You can also tell us your opinion. People going with choice A. It also have C from Stephen Njenga. Na pia D because we have all of the options. Yes. I remember paper 1 for our case during our time, Morphine, when we did our May 2024 paper that was performed better than paper 2. And most people failed in paper 2, which was very easy. By the way, there are 3 states, could call it. Kuna hii ya tatu. Credit. So let's reason together. Let's look at these choices. Public health services are given free of charge. Is this statement true or false? So look at option A. The statement is true. It is the responsibility of the government to provide health services. It is the responsibility of the government to provide health services. B says the statement is false. People pay indirectly for public health services. Choice C says the statement may be true or false depending on the specific service required. And then B, the statement may be true or false depending on policies of the government concerned. So, do you get the public health services freely? All of us are in Kenya. Do we get them freely? So, do we get them freely? Is choice A really right? Choice A. Can we eliminate choice A? Because we don't get all services free. Some we do pay for them. But others are solely provided by the government. So A, I think, is false. Shauna Lipande Upate. So what about choice B? Are all services free? What about choice B? Not all services are free. But in this context, Naswali Kombali, B is saying the statement is false. People pay indirectly for public health services. Yes, people pay directly, but are all services? Do we pay indirectly for all services? Do we pay indirectly for all services? I also think no, we don't pay for all services because let's take for the sake people who are in Budalangi, these floods. kuna vile tunalipa floods for tunalipa for people, those people that are affected with floods. Do we pay something for that case? Indirect taxes. But we also have non-governmental organizations that come in and finance such services. We also have some NGOs, those emergency funds that come in to finance that. So I'd also say that actually the bi kidogo pia iko nje, imeuma nje kiasi. Do you agree with me? They finance but not fully. These taxes are paid. Because actually not all money is coming from the people. The government also has another way of getting funds for emergency. For example, in the case of emergency services, immunization services are free. And then also get to know this one. Not everyone pay taxes. Kuna those, even public health services, those people, for example, they are called the people, these people wanaitwaje, these asylum seekers, they don't pay anything, but they are actually enjoy these services. Not everyone pays for those services, whether directly or indirectly. There are some individuals that are exempted. The destitute, the destitute people. Yeah. So is choice B right or wrong in that context? Those destitute individuals. So it is wrong. So what about choice C? That's how we are eliminating pole pole too, and then we narrow down to the right answer. Choice C is saying, Hamai, please refer the question again. Now I combine, I'm trying to trace it. So choice C is saying, taking the statement may be true or false depending on policy. Not that is the statement may be true or false depending on the specific service required. Is that true or false? Is it right to say choice B is right? Choice C, I mean. Oh, not true. I'm also in support of that, by the way. I don't think Manu's false. Yes, Manu, why not? Why not choice C? It also depends on the type of services. There are some services that are true, that are free, and some that are not free. Emma, please convince Manu. Aone in that direction. So let's have also a look at choice D. The statement may be true or false depending on policies of the government concerned. The statement may be true or false depending on policies of the government concerned. So how do you see choice D? How do you see choice D? In comparison with choice C. Who wishes to say something, nimpatie mic. Nani anataka kusema kitu? Nimpe mic. We compare B and D. So Sandra send us something. Sandra, what's the source of your answer? It's saying that the statement is false. People paying directly for public health services. By then nilikuwa naangalia the PAE. It's NCLEX, Quizlet. Mbaya. So do we borrow that? Do we borrow that conviction from Quizlet? Should we borrow that conviction? I'm even surprised. So people pay directly to receive government services, e.g. they pay business license fees indirectly through Kwanza PAE. Hey, forget this thing. Kama hujakuwa employed or if you're not getting government money, you don't know the pain of pay as you earn. It's very huge amount of money. It's almost half of the basic salary. We usually have the gross salary and the basic salary. So it's almost actually relatively closer to the basic salary. So this choice B, they really deduct a lot. Do we borrow that conviction? Maybe we pay, maybe even those disadvantaged groups, pengine sasa the people who are employed when they are deducted their money, they pay directly, but now it's not those disadvantaged individuals that are paying, but perhaps we are paying for them. Ama hiyo ni ya majuu, because I'm actually not seeing sense in the context of Kenya. Yes. So what do we sit with? What's your opinion? Or can I assign someone that question? Can I assign somebody? Bado naona kuna B and bado naona kuna C. So let me assign this question. Though I know it will be difficult to reach to an agreement. Let me assign this question Kati and also Manu. Mutufanyie research. Towards the end of the session, ikibakia 5 minutes, all of you come with the rationale, explanation. Organize your faculty of reasoning so that you convince us whether C is going to be the right answer or whether B. So I'll give you an opportunity back here, 5 minutes time. Yes, Kathy. Yeah. And any other person who is interested in the same also, you are free to have that. So the person indicating the Nini just placed their B stroke C, but actually Kathy and Manu, please prepare to convince us which one is the best answer. So let me get the next question. I'm actually stopping at 3. I had requested that I moderate up to 3 because there's somewhere that I want to go. So sorry for that. I'm quite engaged in a few minutes to come. So the next question, 35, level 4 hospital is classified at what level of facility? Primary, secondary, intermediate, tertiary. Level 4 hospital is classified. Those sub-county, they're called sub-county hospitals. They are classified at what level of facility? Primary, secondary, or intermediate, tertiary? So that is the rationale. Sandra sent the rationale for B. The statement is false. People pay indirectly for public health services. Community health services, including public health services, are paid services through taxation. So that 5 I'm seeing we're having B from Chill, Climex, Irene, Talam, Mali, Synod, Joxin, MG, Magda, Sabi, Kerry, Mami, Queen Hamei, Dawson, Nanzi, Hams, Alain, Nemo, Nanok, Skilly. Everyone is going with choice B, which says it is secondary, level 4. Now tertiary level, okay. Why not primary? Tertiary in level 6. Level 5 ni gani? What about county hospitals? They are going to fall under where? So dispensary in your primary. Can someone share the evidence of tires? I want to get something. County level ni 5. Level 5 ni county hospitals. Can someone share that evidence on tires? I want to need something to source there something. Because there's something called primary facilities. Yeah. Tier 1 to tier 4. Tier 1 inakwanga those at the primary, hiyo ya CHVs. It usually include at the primary level the CHVs and all dispensaries and maternal homes. Tier 2. And then tier 3. So ndio hizi. So this is what I wanted to have a look at. Thank you, Kati. Look at health centers, maternity, and nursing homes. Now look at tier 4, tier 3, I mean. Tier 3 entails county referral hospitals, both secondary hospitals and also primary hospitals. This is what I wanted to. Primary services are different from primary hospitals. So primary hospitals are also called level. And tertiary hospitals are national referral hospitals. So level 5 ndio secondary hospitals. And now Alain has also shared something. Thank you, Alain. So we sit with which choice? We sit with A. Okay, thank you. So Kips has also shared something on the same. Yeah, those levels. I think ilikuwa kitambo. Ilikuwa na provincial, national, district level 4. Hii ni ile ya kitambo, levels of healthcare provision. Saizi zinaitwa sub county, then you have county referral. That's also shared something. It's also ironical with the above evidence. Choice B. But under the tier system, I know level 5 also called primary hospitals. Not primary care facilities, but primary hospitals. So I'm really not sure. We are in dilemma in this state. Are we going to sit with both and us? Though we know primary services, so we're sitting with which evidence, with which choice? Can we have more evidences? Though we do understand that primary services are provided in this at the community level, yeah, at the grassroots facilities, primary services, yeah. So what's your opinion? Do you sit with choice B? Do you sit with choice B in that regard? Often primary services are provided in these grassroots facilities. Tumezoea choice B, so tusiti na hiyo. This is current. All right, so okay, let's settle with choice B then. Okay, so Kati, are you in the chat? Can you be able to take over from that point? Kati or anyone, any other moderators in the chat? Emma, I'm seeing you are also in the chat. Okay, Kathy, thank you. I think you can help me with that. So
Pepa ni ngumu wewe. Hey. We. Emma, muffin wako alienda wapi jamani? Next question kindly. To thank Stan. Thank you, Stan. Thank you so much for the knowledge. Thank you for everything. Naona tu Morphin yuko kwa chat na haongei. Morphin. Mtu ameraise mkono. Nani? Jess. Jess, you wanna speak? Unmute.
Thank you so much. Ebu, let me just clarify something quick. Talking about history na tires, we have at the community levels, niyo tier 1, right? Penye we have the village, the households, the family, and the individuals. Okay, then we go to tier 2. Tier 2 inakuja penye we have dispensaries, we have health centers, we have maternities, tuko na nursing homes. So hiyo ni tier 2. It combines tier 2 ina combine both health centers na dispensaries and clinics. Alafu tuko na primary hospitals and secondary hospitals, which is the county and the county referral facilities. That is the primary hospitals and the secondary hospitals. Then we have tertiary hospitals, which is the national AMA, the referral hospitals. I hope you're now okay with that. Thank you.
Thank you, Jess. Are you able to continue? Because I have a session at 4 p.m. here. Singependa kuumiza sauti sana. That's if you are able. Umenisikia kweli? We, kuna mtu anataka kuongea rhythms. Unmute 30 seconds.
Yeah, good afternoon, everyone. From my understanding of the health system tiers levels in that is primary, secondary, first, tertiary. In tier one, we have level 1 only, and then tier 2 we have level 2 and level 3 facilities, and then tier 1 and 2 comprise of primary care facilities. Then in tier 3 we have sub-county and the county referral hospitals, which have level 4 and 5 consecutively. Level 4 in sub-county hospitals, and then level 5, of course, in the county referral hospitals. Those ones, they contribute to secondary facilities. And then tier 4 carries only tertiary hospitals, which are level 6 hospitals, and those are tertiary facilities.
Thank you, Rhythms. I think imeeleweka sasa. Let's go to the next question now. Can you send me the next question? I'm waiting for the question. Haya, Bebo. Wapi swali wa jameni? Who was sending the questions? Ama nijitafutie huku juu. I'm good, mama. Thank you, Hamei. So, 36 says, what is true of primary facilities? They are usually government run. Their services are provided on an outpatient basis. There are training facilities for health professionals. And then D, a community hospital is an example of this level of health facilities. Primary facilities. Tumeongelea primary facilities hapo juu, si ndio? Level, sorry, they are in tier 2, si ndio? Tier 2 ndio primary facilities. Hiyo level what? Level 3, si ndio? So I can see people are going with B. Big questions ziko hapo juu. Imetumwa tena na Rhythms hapo juu. So 36 B from Arel, Abebo, Eva, Emma, Edwin, Saino, Maggie, Klimek, Miss, Elaine, Habibi, Jimwiti, Bree, Purity, Vabi, Tara, Chill. All are going with B, Sandra B. So B inasemaje? Their services are provided on an outpatient basis. Yeah. See, I think it was explained by Stan, by Rhythms, na imeeleweka. Thank you. Community hospitals ni example ya. Community hospitals ni kama ni health what? The health centers, ndio? Community hospitals ni kama health centers na ziko tier 1, si ndio? Hakuna mtu wa score sheet. Limoni, walikuwa unatuma maswali ama kindly yake utaweza tusaidia mama? Kama si wewe wa score sheet wa maswali unaweza tusaidia na score sheet. Thank you so much. Morphine, thank you Morphine. Thank you Morphine, unaweza unmute. Niko fatigued.
Okay, thank you. Maybe you can summarize that question and then we go to the next. Naona kama una strain, but yeah, unaweza pumzika kwa sababu for you guys, you are doing at a program interval. So let us yeah, so let us get the next question and we utilize the few minutes we have up to 4. Oh, this one I'm serious now. So so let us get the the next question. I hope you are satisfied with from the previous question on the levels of the tiers. Not those tiers, the levels also in terms of primary, secondary, tertiary levels. The systems of governance is in the healthcare delivery is key and very important, especially for us after this exam. You will be working at different departments or the different levels of government. So those chains of management are key and very important. Yeah. Remember what I like about paper 2. Yeah, it employs some practical aspect of things, at most of the time. Practical aspect of things after this now. Practical. It's more practical. Yeah. So yes, karibu. So can I get the next question now? Nimemchukulia kadi at least kama pumzike pia so that they will take over the other sessions. So can I get the next question now? Who's the sender of the questions? Let us focus. Who's the sender? Who's the sender of the question? So that at least the tackle the second question of the previous. So from the score sheet, actually to see course to update the score sheet, that part is very important for those who are not here, so that they are able to now napaswa kuanzia 37, right? They're trying to locate Jago boy. Lakini sauti haikai ya mtu wa Jago. Okay. Yeah, that is we are supposed to see from continue from 32. From 32. So so I'm supposed to begin from 37, right? I need some guidance. Oh, Jacob, I mean, yes.
Muffin nasema tulikuwa tumeanzia hiyo 32, so you can just continue on 37 sahihi.
So I'm supposed to begin from 37.
Okay, endelea to 37.
Oh, I'm asking, am I supposed to begin from 37?
Yeah.
Okay, thank you so much, Kadi. Yeah, na nilikuwa nadhani kama ni Jacob ndio alikuwa anaongea sauti, kumbe ni Kadi. So 37, which says, Jacob wanted to speak. Jacob, I want to give you 0.007 seconds. Jacob, 0.0006 seconds.
Just continue. Kate amesha clarify.
Okay, now you can continue. Okay, thank you so much. So for 37, which says, which is an example of school nurse health care providers function. So, which is the example of the school nurse health care provider function? A, requesting for BCG from EPA, which is the expanded program of immunization store for school entrance immunization, and then B, conducting a random classroom inspection during a measles epidemic, and then C, taking remedial action on the accident hazards in the school playground, and then D, observing places in the school where people spend their free times. Tuanguke nayo. So what is we have an umbrella of the functions or what are the roles of a. So naona mnaanguka na C. Okay, C. Miss ni C. Or someone to kuna mtu ajibu lile. So Emapenta C. Climac, okay, Climac C. Malay C. Talam C. Relay C. Winnie, how are you? Winnie C. And then Sir Edwin C. Then McKenna C. And then Devina C. C. Why are we saying C? Let me go back and see why are we saying C now. Why a majority of you saying C, which says, 37, which says you take remedial action or an accident hazard in the school playground. What do you call that one? What do you call that one? Oh, you have not done anything, Climac. Actually, nilikuwa nadhani not Climac. I was confusing Climac with huyo mwenye alikuwa na jina refu. Okay, so why are we saying A? I'm not telling you to change your option, but I'm just saying, oh, somebody is crying. Why are we saying C? I was just asking, don't change your response. 37, which is an example of the school health nurse. For school entrance, immunization. B, conducting a random classroom inspection during a measles epidemic. Remember, we are told school health nurse. Observing places in the school where people spend their free times. So which is the right response? Which is the right response? And which is the right response? Hey, yeah. Baba Nadine, by the way, ningeenda na C pia on my side, but because it's like, what is the role? Okay, let us bring an aspect of what is the relation between the, what do you call? Yeah, thank you so much. I think somebody has Joy. Thank you, Joy. What's the relationship? We have to relate the school health nurse. Are we together? The role of a school health nurse. So our focus will be to think in the context of school health nurse, not just a general umbrella or the function. Then, yeah, I hope I'm clear by the because sitaki kuongea peke yangu. I hope I'm clear. I like confirming my clarity. If I'm clear, then am I fast? Am I slow? Am I moderate? I want to. I like. Oh, Morphine alikuwa very slow. Hatujakava hivi. Yeah, it was so fast. It was so slow, moderate. Yeah, but like at least I'm getting from the feedback now. Thank you. So we also have to know the role. So what are the other roles of health? I mean, school health. Yes, you have to rule out. What are the other responses means, or what's the definition of a school health nurse? What when somebody tells you you are somebody says she's a school health nurse or is a school health nurse. Okay, provision in the context of what? Service provision are qualified. So what or how do you define? Yes, right? Or school health services. Are we together? Prevention of minor ailments and all those an umbrella of services. Are we together? Good. Now, what I just want to give give an overview or the okay. You are working in a facility or you are working in a maternity. Let me say so. Yeah, or call it any department. Thank you so much. So let me just say a clinician or maybe just call him or whatever. You observe in the line of nursing. Yeah. They are providing a patient who is maybe in immunocompromised state, a high doses of a drug that may, as you are thinking, might bring a negative implication to the patient health. Yeah, and you tell that physicians, no, this one might alter the health or might bring a negative implication to the health of the patient. Yeah, even if maybe you are not in the position of doing a prescription. What role are you playing in that context? Yes. Ama unaona tu unasema tu just give. So ndo emo. Just give. Utaambia hivyo. So I like that part of advocate. Let us be our patient advocates, right? Because now you are trained. You are trained healthcare provider. If you cannot support them through an advocacy, advocacy is an umbrella. I mean, without advocacy, there are many things that goes wrong. So take that advantage, or be your patient advocate. Yeah, protecting patient rights in many legal aspects. Thank you so much. So kuna kitu imetuma hapo. There's some information though I'm not getting. Inakaa it's not clear. But all in all, somebody was starting to assume Winnie was saying what about A. Let me just go for school entrance immunization. Who can respond to that? Nana tajibu hiyo A. Somebody was saying A. Who can answer? Community health nurse role. Thank you so much. Yeah. Can I see it now to the next question? Can I see it? This school going children. Who will answer Prudence? Okay, when you say a school age children, give us an age frame. Give us an age so that we judge from the age. Yeah, there's something called missed opportunity, and there's something we call PRI. Who can remember PRI? PIRI. So yes, up to 15 years if not infected with TB. Yeah, Emma. Can I get the next question? Can you sit it at it? Good people. Yeah. Someone to give us the full meaning of PRI in the context of immunization or KP. Ukipata ukuje utuambie as is an assignment PRI. Okay. Can I sit it? Can I sit it? Do you repeat nowadays? No, just confirm from the healthcare provider. I mean not I mean caregiver, sorry. Just confirm from the caregiver. Hata akisema najua na there are those terms they like to use Daktari najua, please just give because na unaona haionekani kabisa na mtoto wangu anapaswa kupata. Alipewa kitambo daktari, but najua sasa haionekani. Oh, namwambia thank you so much for that answer. So yeye hatapewa. Yes. Those are the new guidelines. Are we together? Yeah. Periodic intensification of routine immunization. An immunization in the context of, meaning is an activity in the context of KP. Okay, it is a activity that actually provide a herd immunity against the population. But what happened actually is that you go across all those who had missed opportunities. Are we together? There are those kids who never got what do you call missile 1, missile 2, yeah, that doses, all those. So you give them across all those who never got those services, an activity under KP, under KP now, which support. Are we together? IFP2, all those ones. So they have missed, and now they are at the advanced stages. They are at advanced stages. Because they have missed once, you give to provide now a herd immunity. Yeah, thank you so much. So can I get the next question? Something has also been said, the roles. It's like I'm having a presbyopia on this one. Oh, Emma was asking polio. We have polio 0, 1, 2, 3. Polio. Yeah. Hii labda sijui ni suma aje lakini. What's presbyopia by the way? Presbyopia. What is presbyopia? So the role and functions of a school health nurses. Direct Who can tell me what is? Yes, now I'm aging. I'm very old by the way. Niko kufikisha almost 60 years now. So age related vision is coming in. Yeah, I think in the next 4 months nitafikisha 60 years. Educators, the counselors, the consultants, case managers, and then community outreach and the researchers. Are we together? Yeah, good. Sijadanganya my love. I'm old. Good. Phantom pay. Dragon. Sawa. Okay, can you get the next question? So just know, I like you to know something, my good people. Now that something was mentioned about the primary, not the primary, but on the all those aspects and with the examples, those things are very important, very very important. So good. So can you get the next question now? Wow. Yeah. 38 now. 38 says, 2010 Kenyan Constitution mandates devolution of the basic services from the national government to the county government unit. Which of the following is the major goal of devolution? The devolution we are now enjoying under the legacy of the late Prime Minister Raila Amolo Odinga. Yeah. So to strengthen the county government units, to allow greater autonomy to county government units, to empower people and promote their self-reliance, to make basic services more accessible to the people. Tuanguke nayo. Yeah. Bado mnaniandama. Sawa. So majority are things. By the way, what is the functions of devolution? Na devolution ilianza lini Kenya? Devolution? Yeah, we are enjoying the 2010 devolution and the courtesy of this the great men, the sleeping lions now. Yeah. Yeah, their souls rest in peace. There are those people who really contributed to this country. It's only that we are sometimes the country is sinking to the wrong directions, but there are those who make the foundations of the things we are enjoying today. And that this devolution. On that the devolution services indirectly. Yeah. The so-called governance at the county level. We have two level of government, the national and the county government. But the county government, what happened? The funds, utilization of the funds. Ni kama imekuwa pesa ya mtu. Yeah. That's why there's a lot of collapse surfaces at the county level. It's only now strengthened at the national level of government. Are we together? Sasa services ya county imekuwa kama inaingia through the throat ya governor. Yeye ndo ana decide kina nani huwa wananisupport. Yeah. Ndio nipate next seat. Yeah. So hiyo pesa huwa inapotea hivyo. Unakaa 3 months bila kulipwa. The likes of morphine or 4 months. Yeah. Good. So, but generally it is a devolution. Yeah. What is the functions of devolution? Yeah, thank you so much. Lakini jina ndo refu bana. Yeah, but it was after 2010, but actually services utilization imeanza around 2013 ukweli yako. Ni Kingling. Wakisiweki Kingling su change tu jina. Na kuomba tu leo this afternoon. Uchange tu hiyo jina, ni refu sana. Yeah. Okay, so D decentralization, right? What are the functions of devolution? Yeah. The functions of devolution. Mi najiita morphine sir. By then nita-update leo profile yangu muone the really morphine by the way. They so that nikimoderate the next section at least mnaona who is the morphine now. I'm active in TikTok, Instagram, Telegram, X, and the rest. Okay. I was asking, what are the functions of devolution? What are the functions of devolution? Wow, somebody has just sent us. I think that document sent by Jess contains a lot of very important information regard to the 2010 Constitution. Are we together? So let me just give you an overview message of what really devolution means. Devolution is that making services available to the people at the periphery. Are we together? Now, instead of you going all the way, mwingine anatoka from Kisii anaenda Nairobi, yeah, unatoka from Garissa, you go to Nairobi, you come from Kisumu, Kitui, yeah, you go to the central government, I mean to the national government. Mimi nimesomea Meru High School. Who knows Mkubwa High School in Meru? Nana najua Mkubwa High School in Meru. Okay, anyway. So so it's just basically a term or another, instead of all of us going all the way to the national government, because we have only two systems of the government. Are we together? So what happened? There's indirectly a way to enhance strengthening service delivery and also to bring equal. Yeah. To bring an equal service delivery at the county and the national government. Are we together? But what happened now? Ukiangalia sahi, it's the service delivery, it's only enhanced in the county government. I think wengi wanajua. Am I saying the truth or false? Nakumbuka tukitoka shule, kila mtu anasema na Mungu anipee nipate county. Sahi acha nikwambie, sisi tunasema tupeleke national government. Yeah. Unasema unasikia tu there was a wave. Yeah. There was a wave time zetu like ukitoka shule kila mtu anasema county. Huyu mtu anajua area za yenye anasema Iku boys. So it was an intention, yeah, to bring services available to the people at the periphery level, to strengthen service delivery in Kimbo, so that people at least are able to access all those services at affordable prices. Huduma Center, thank you so much. Thank you so much, Jess. Those are the services, yeah. The basic important government services, strengthening at the periphery. But what happened? To our governors? What happened to our governors? We just pray to God tujiekea. Yeah, wameu health. Unakuta facilities inakaa kama nyumba ya mtu. Even you don't have a paracetamol. Are we together? So we just pray God, we get a good health, good governance to strengthen service delivery at both national and the county government. At the county government. Among the 47 governors in this country, the only governor who is running this, county very well, the governor of Murang'a, Irungu Kang'ata. Is it Irungu? Anaitwa Irungu ama Kang'ata? Yeah. Ukienda huko working, Irungu Kang'ata. That guy, I like how he delivers there. Achana wengine wote. That guy deserves to be even more than president. Lakini wapi? In this country, vitu si venye tuna imagine. Yeah, I like also the Kitui also, exactly. The Ukambani guy, county Suko. Kitui and also what do they call? Yeah, so those are the importance of devolution, but it's not the way it's supposed to be. Just pray to God. Can you get the next question? Was it question 39? Question 39? Thank you so much. So 39 was saying, which level of health facility is usual point of entry of client into the healthcare delivery system? We are told which level of facility of health facility is the usual point of entry of Mami Queen yeah. What happened whenever I come to group? Yeah. I just see the usual people, but I don't see my good friend. Anakujanga rarely na sijui mbona haonekani. My very, very, very good friend. Yeah. Thank you so much. Who's this? Jess. Wow. Jesse, Mungu akubariki Saidi na Saidi. Because you can't get this evidence in the whole world. This evidence you cannot get. Because the only person who can have level and community health, 2 dispensary, 3 health, 4 hospital, 5 county hospital, national, for example, national, private, secondary, tertiary. Allah, kumbe yes, hai. Sawa. Sawa. Kusikia ame. Good. Emma was asking, what about intermediate? Oh, it's very important just know those levels. Those levels of government, and not government, but those levels of systems, levels of, healthcare delivery. They are very, very important. And I was telling you, paper 2 is more practical part of things. Ni vitu yenye tunapata huko nje. Yeah. Leadership roles. Yeah. Can I get the next question? With your permission. Can I get 101,000 CT? 101,000 CT? 101,000 CT? 101,000 CT. Thank you so much. That one is enough. Hiyo imefika 101,000 CT. That one is enough. Can I get the next question? Kuna mtu ameandika Gazelle ameenda wapi? Oh my God. Gazelle. Okay. Can I get the next question? Good people, can I get the next question? My good people, who was the sender of the questions? Twins, triplets, what else? A good boyfriend, a good husband. Yeah. Health nurse is the supervisor of the rural health midwives. Which of the following is a supervisory function of the public health nurse? A public health nurse is the referring cases for patients to the midwife. B, providing a technical guidance to the midwife. C, providing a nursing care to cases referred by the midwife. D, formulating and implementing training program for midwives. Yeah. Kumbe nikisoma mko mnaongea mambo mengi hapa. So, let us respond. Yes, Jungo. Because naogopa kugongewa na Manu. Specifically Manu ndo naogopa. Yeah. Ndo naona siendi mbali. Yeah. Kidogo tu nakuja naangalia area narudi. Kwa sababu naogopa Manu. So naona watu wanasema D. There is a B and D. There are those who are also saying D. Jim Weti anasema D, but majority are saying B and B and there's also D. So there's a controversy between D and B. Why are we saying D and why are we saying B? Yeah. The reason I'm coming to check Emma kila wakati ni juu naogopa Manu. Why are we saying question 40? Why are we saying B? Those who are saying B, why are we saying B? I want a representative of B. You say morphine on behalf of B. Then those who are saying D, morphine sulfate. Those are my names as per the ID, national ID. Need two representative of B and D. Yeah, you just raise your hand. You say morphine sulfate on behalf of group D. We are saying this and this and this. You give us a rationale. That is the discussion. Na hiyo utasahau, by the way. Yes. Oh, someone to assist Hame. Hame ametoka kidogo. Thank you so much. Somebody, let me just read something here sent by, was it Miss? Wacha tu nisome ya kwanza Miss. So yeye anasema supervision in a professional context such as the public health nurse supervising a rural health midwives primarily involve providing a technical guidance and support to ensure that the work is performed correctly and effectively. This includes mentoring, quality control, and ensuring adherence to standards and protocols. Referring cases, A is a function of a clinician, not a supervisor providing direct nursing. Wow, thank you for that effort. So, who is the role of a public healthcare nurse? So it's just basically the role of leo sioni nikioga pia. Oh, Baba Nadine mbona? So health supervision, healthcare, I mean the monitoring of healthcare services at the sub-county level. Are we together? So why are we saying B? And why are we saying there are those who are also saying what do we sit with? Tuna siti na gani? Yes. Tuna siti na gani? City B? Thank you so much. Thank you so much. Mtakuwa mmenisave time yangu sana. Thank you so much. Thank you so much. Can I get the next question with your permission? Baba Nadine then. Kuna siku nasikia kulikuwa na vituko huko. Okay. Okay, thank you so much. Who's the Hamei? Oh, ni Water. Ni venye nini nafanana na ya Hamei. Water, thank you so much. Let me even good. So this one says a public health nurse and nothing has the respondent to an advance in medical sciences, modern technology. So public health nurse are found in a various health settings and occupying a various role in the way. It's a very, very beautiful evidence, lakini sasa do highlight pia. Unaweza tusomea Water? My good friend Water. My good friend Water. Are you in a position to read for us the part that you can see very important for us so that we can move also? We have 7 minutes to go. Or I nominate one person to read on behalf of you. Niko kelele, let me highlight. Let me just nominate one person to read for us. Wenye sijawahi sikia wakiongea kwa hii forum. Muliwahi sikia Kerry akiongea kwa hii group? Kerry? Muliwahi? Okay, Marley. Okay, Kerry, tusomee your evidence that was highlighted by Water. Very, very beautiful evidence. Kerry, tusomee Kerry. Oh, Kerry nimeona hapo Kerry ako kwa group. Yeah, ameweka earphone tu anasikiza hapo. Si bora mtatuma evidence, bora mtatuma maswali. Yeah, manze mimi bora tu nimeweka earphone hapo masikio. Yeah. Nasikiza tu venye wanatuma maswali hapo. Manze maswali hapo, wengine wakituma evidence na session ikizonga bana, makifika 4 tunasonga pia tukienda unit wise. So supervisory function. So the public health nurse is supervisory plan and conduct as supervisory visits. So agencies policies in a manner that improves performance and promote job satisfaction. Provide a checklist. The supervisor identify the problem within the agency and address problem by providing a solution. So what they do, they work under sub-county MOH. Are we together? So when they do a supervisory function at the health facilities, so maybe they come to this health center, they identify gaps. There are those key parameters they actually use to when you call supervision. Supervision conducted by the sub-county. What are the key indicators? Can someone tells me the key indicators in immunization, especially in when conducting some supervision at the sub-county? Let me just say so. The key indicators of concern. Indicators of concern. Yes. Indicators of concern. So for the interest of time, so those indicators like Penta 1, Penta 3, or the fast antigens and the that. Why are we not much interested with second? Because you must know that you are concerned when the child start immunization services and whether they have completed, and also for the NC clinic and then the likes of vitamin A and deworming, those services utilization. Are we together? They also, with the sub-county team, they also check on some of the gaps in that facility. What are some of the issues or what are the challenges? They document so that an implementation can be done at the county level. Are we together now? Are we together? Okay, something was sent here. Can I read? 37. Conducting a random classroom inspection during measles epidemic. Random classroom inspection is an assessment of the people's students and teachers for signs of a health problem prevalent in the community. So you're not support gun. So meanwhile, as we respond to someone to respond to Sandra, can I CT? Can I maybe cover one question and then you shift to unit wise? Good people. Good people. Yeah. Let me get that question. Let me get the next question. Kindly. Who was the sender? The sender of the questions. Thank you. Thank you so much. Najaribu kusana na time ndo nisifukuze pia na Nadine hapa. I hope Nadine is here. So 41. According to the Freeman and Henry's community health nursing is a developmental service. Which of the following best illustrates this statement? Community health nurse continuously develop himself. Community health services. Then C, community health nursing is intended in a primarily for health places of residence. Hizo ni maswali za kufikiria somehow. Let us respond to 41. Kota A, Nisqui A, Dragonas A, Shield A, Maggie A, Alain A, Survivor A, and then kuna Precy A. What about the rest of us who are in this chat? What about the rest of us? Sandra. According to the Friendman and Henry. Hii ni kutoka wapi my friend? Kuna mtu ametuma something hapa. Miss. Hii evidence inatoka wapi? Community health nursing is considered a developmental service because it aims to help community develop their own capacity to address health issues. This best illustrated by the use of the health education and community organizing which empowers the community to achieve. Nadine amenipata. To achieve ni Nadine. Oh, Grahams, not Nadine. Huyu ndo alipewa na Nadine sasa. But huyu pia ako very on time management, ako number one. Good people, mimi Sitaki violate the group norms. Yeah. Sitaki nipatikane na Nanok hapa na Kadi, Emma, Manu. Yeah, sitaki nipeleke kotini na hawa. Yeah. So, an educator, there's some role of a community health nurse. Thank you so much for that. Nanok, ako gangari na given duty. Good. So, what is the last response? What is the fourth one? What is the Emma anasema tumalizie. Sawa. Nataka tumalizie swali so that at least we shift to unit Y. Sitaki ni kaya hapo sana. Yes. Good people, tumalizie last question so that at least tumalizie last question. Before moderators or the admins now lands on my neck. The zygomatic process. Yeah. So according to the Freeman and Henry Community Health Nursing, it's a developmental service. Which of the following is the best illustrate this statement? The community health nurse continuously develops himself. Okay, B ndio nasema correct answer. Health, education, and community organizing are necessary in providing a community health nurse. How can you believe that this one is the correct answer? You know, you can put this information or that question in a word, and you can just watch, highlight, because you can also just put that one in a word, and then you highlight on a red bullet. So, but sijasema ni water ndo ametuma. I have not despised your response lakini. But we just need a top up, a top up evidence so that we all come into conclusion. But I can't take it for granted. Also, thank you so much for sending at it's also one way of saving time for us. Water is for life. So, thank you so much. Naona nikipigwa ngumi na kina Nanok na kina water na kina na kina Kadi na kina Emma and the rest. Manu, Jess, Kefa, Stan. So, mulisema mtanipea evidence. I need an evidence so that at least nimalizie. Sitaki kuenda beyond hapo. So that nimalize. Good people. Dragon nas. Okay, you can see from next. Okay, let me just stop it from there so that tutaendelea hapo 4. I mean not 4 but 8 p.m. Are we together? Are we together? Diagnosis. I don't want to consume your time because you must also utilize a 1 hour unit wise. Unit wise is also very so much good people. I hope the session is recorded for the part that was done by Stan and the part done by the morphine sulfate. That is me. I hope both sessions is recorded for the purpose of reviewing later. So thank you so much, good people, for your attention. Those who have sent us an evidence, those who have sacrificed to send us questions, updating the score sheet. We never take for granted that energy. Ni kujitolea na tuna. Yeah, thank you so much, Nanok. Let us continue with the same spirit. Are we together? Let us not panic. Let us just be consistent in our discussion. And let me just tell you for free, this cohort is also the best cohort. You guys are really trying. But don't regret. Don't go back. Just maintain the spirit. We had previous cohorts, and from the pattern, you people, the way you are doing, tunaelekea on the right track. So just maintain, be active. Ukiona mwingine amekuwa tayari kidogo off the way, unakuwa on na tunakuwa sawa. And unit wise, it's very key, very, very important. So that's all what we have today, and thank you so much.